Hello guys, welcome and welcome to Meet International Academy, one of the leading academy in training nurses in the nursing competitive exam as well as IELTS and flex and OIT training. And today in this magic pill session, we are going to discuss very important topic, that is hemodynamic monitoring. In the last class, we discussed about cold chain. That is also very topic. Those who doesn't watch those videos, please watch the video. And today the session start with hemodynamic monitoring. And if you like the video, please like it, share it, and subscribe to the channel. If you are subscribing the channel, it will motivate us to post more and more videos. So let's begin the session without wasting the time. So actually it is a part 1 and part 2 video will also be there. It is a basics of hemodynamic monitoring. Okay, but these questions are very important. Already these questions are asked in the previous year examinations. Okay, so let's start with the first one. The normal mean pulmonary artery pressure is. They are asking mean pulmonary artery pressure. Okay, see, artery pressure is separate. Pulmonary artery pressure is separate. So mean pulmonary artery pressure is separate. So here they are asking the mean pulmonary artery pressure. Okay, so here they have given 4 options like 10 to 15 mm of mercury, 15 to 20, 20 to 25, 25 to 30. 4 options they have given here. And among this, the right one for mean pulmonary artery pressure is option B, that is 15 to 20 mm of mercury. So why I selected this option? Let's see the rationale. See, the normal pulmonary artery pressure is 25 by 10 mm of mercury. Okay, 25 by 10 mm of mercury. Okay, so the mean pulmonary artery blood pressure, it is calculated by using the formula. That is, here you can see the formula very well. Mean pulmonary artery pressure is equal to pulmonary artery systolic pressure. PASP means pulmonary artery systolic pressure plus 2 pulmonary artery diastolic pressure by 3. With this formula only, we are going to calculate the mean pulmonary artery pressure. MPAP, mean pulmonary artery pressure, with this formula only. Okay, so let me give an example here. So with this values, we can substitute here. For example, pulmonary artery systolic pressure is 25. I have dropped the 25 here. Plus 2, according to this formula, plus 2, I added the plus 2 here into pulmonary artery diastolic pressure, that is 10 mm of mercury. So I added 10 mm of mercury and divided by 3, it is giving what? 15 mm of mercury. That is why we selected option B, that is 15 to 20 mm of mercury. Once again, I will repeat, please listen carefully. See, this is the formula, MPAP. That is mean pulmonary artery pressure is equal to pulmonary artery systolic blood pressure plus 2 pulmonary artery diastolic pressure by 3. This is the formula to calculate the MPAP, that is mean pulmonary artery pressure. Okay, so according to, as per this formula, I'm going to substitute the values which I have given here. That is 25, that is pulmonary artery systolic pressure is 25, pulmonary artery diastolic pressure is 10. I'm substituting these values and I'm getting the value, that is 15 mm of mercury. So this is the right answer. Okay, fine. Apart from that, few more vital points are there related to this question. Okay, so here you can see in the beginning of the session itself, I said that there is a mean pulmonary artery pressure and pulmonary artery pressure. Okay, so these are all the different things, different types of pressures. So what is pulmonary artery pressure? PAP, PAP, PAP. It is a blood pressure in the pulmonary artery, that the large blood vessel that carries blood from the heart to the lungs. While the pulmonary artery is carrying the blood from the heart to the lungs, yeah, pressure is created, that is called as what? Pulmonary artery pressure, that is PAP. Whereas what, according to the question, what we have discussed is normal mean pulmonary artery pressure. Normal mean pulmonary artery pressure, that is 15 to 20 mm of mercury. That is the right answer. Already we discussed that. Okay, but if it is more than 25 mm of mercury at rest, underline the word at rest, if it is more than 25 mm of mercury, or during exercise or during strenuous activities, if it is more than 30 mm of mercury, it shows there is a problem in the heart. Okay, the pressure is increased because there is some problem in the heart, especially in the ventricles of the heart. Understand, guys? So this differentiation you should know. Okay, so one more thing is there. So this is another one, that is mean arterial pressure. See, in the beginning, we discussed about what? Mean pulmonary artery pressure. That is totally different. Okay, so this question is totally related to mean pulmonary artery pressure. And apart from this, I am discussing the vital point. That is what is pulmonary artery pressure. That is the extra point, additional point I am giving to you. Okay, the same way, one more vital point is there. This question already asked in the exam. So that's why I added this one. The previously we discussed about mean pulmonary artery pressure, right? The same way here, one more arterial pressure is there. That is normal mean arterial pressure. What is that? Mean arterial pressure. So here, the normal mean arterial pressure, there is a formula to calculate that. That is 2 diastolic blood pressure plus systolic blood pressure by 3. So this is called as what? Mean arterial pressure. And the normal mean arterial pressure is 70 to 100 mm of mercury. Okay, guys. So the next question is, difference between systolic and diastolic blood pressure is called as. They are asking the difference between systolic and diastolic blood pressure. So if they are asking difference, you have to minus the systolic blood pressure with diastolic blood pressure. You have to subtract systolic and diastolic blood pressure. So here they are given options. That is pulse range, pulse pressure, pulse length, pulse deficit. 4 options they have given here. So the difference between systolic and diastolic blood pressure is called as what? So the right answer is option B, that is pulse pressure. What is that? Pulse pressure. You can see the rationale here. Pulse pressure means the difference between the systolic and diastolic pressure. And the normal value is 40 mm of mercury. If you are subtracting the systolic blood pressure, that is 120 is the systolic blood pressure and 80 is the diastolic blood pressure. If you are subtracting 120 by 80, 120 minus 80, and you will be getting the value 40. So 40 is the normal value of pulse pressure. Okay. The next one is pulse deficit. What is that? Pulse deficit. It means that difference between the apical pulse and the radial pulse. Okay, usually there will not be that much difference between apical pulse and radial pulse. The normal value is 0 only. Okay, but if there is a difference between apical pulse and radial pulse, there is a difference is present. Okay, so that is commonly seen in the atrial fibrillation. And if the difference is present, means it is called as what? Pulse deficit. It is called as pulse deficit. Is that clear? So pulse pressure means difference between systolic blood pressure and diastolic blood pressure. That's all. And pulse deficit means the difference between apical pulse and radial pulse. That's it. And it is commonly seen in atrial fibrillation. Okay. So the next question, the pulse pressure, it is related to previous question only. Okay. The second question and third questions are connected to each other. So already we discussed about pulse pressure, right? So pulse pressure of BP 145 90 mm of mercury is. So they are asking the value. The pulse pressure of blood pressure 140 by 90 mm of mercury is. So 50 mm of SG, 140, 90 and none of the above. So which is the right answer here? So what are you supposed to do? What is pulse pressure? Difference between systolic and diastolic pressure. You have to minus 140 by 90. At last what you will be getting? Your answer will be 50 mm of mercury. Okay, the formula is already mentioned here. PP, that is pulse pressure, is equal to systolic blood pressure minus, getting the answer what? 50 mm of mercury. Okay, fine. The next additional vital points. So here you can see all the key points which is related to pulse pressure is mentioned here. The meaning is difference between systolic and diastolic blood pressure. Already we discussed this so many times. The next important point is the normal range is 30 to 50 mm of mercury. Okay, fine. And I have solved one question also here. You can just check it out. Here, the important point, what I want to say is there are 2 types of pulse pressure. So this is the golden point I want to add extra. Okay. So there are 2 types of pulse pressure. The first one is wide pulse pressure and second one is narrow pulse pressure. Please make these questions already asked in the exam. So listen carefully. So wide pulse pressure means when there is a huge difference between the systolic and diastolic pressure. There is a huge difference between systolic and diastolic pressure. What is the normal systolic and diastolic pressure? 120 by 80 is the normal systolic and diastolic pressure, right? If there is a huge difference, for example, you can take 160 by 70. Okay, so there is a huge difference between systolic and diastolic pressure, right? So that is called as what? Wide pulse pressure. The next one is narrow pulse pressure. So narrow pulse pressure means there is not much difference between the systolic and diastolic pressure, but still there is some differences present. Okay, there is not much difference. So that is called as what? Narrow pulse pressure. Wide means huge difference and narrow means difference is present, but that is not much. Okay, so these are all the additional points. The next question is normal portal venous pressure. Usually when we will be checking the portal venous pressure, if the patient is suffering from cirrhosis of liver. Okay, so in cirrhosis of liver, already while I'm taking the gastrointestinal class, I explained very clearly about cirrhosis of liver. See, in cirrhosis of liver, normally in the liver, enormous blood vessels are present inside the liver. Excess amount of blood vessels are present inside the liver. In cirrhosis of liver, what will happen? The contraction of the liver will take place because of the necrosis of the tissues or necrosis of the cells. So once the liver is contracting, the blood vessel, whatever present inside the liver, it is going to get squeezed. So all the blood, whatever present inside the blood vessel is going to gush out. Okay, so the blood will be regurgitate or backflow into many areas. For example, if the blood is backflow into the peritoneal region, then it will cause what? Ascites. If it is going to the rectal region, it will cause what? Hemorrhoid. If it is going to the esophagus, it will cause esophageal varices. So these are all the complications of cirrhosis of liver. What are all the complications? Esophageal varices, ascites, and hemorrhoids. And the caput medusa will be there. What is caput medusa? Very important question. Already this question asked in the exam. That is image-based question asked in the exam. If you see the trunk and abdomen of the patient who is suffering from cirrhosis of liver and portal hypertension, see the dilated blood vessels, you can see very clearly all over the trunk and abdomen. Okay, just Google the picture of caput medusa. It is very clearly given. And this question already asked in the exam also. So these are all the complications of what? Cirrhosis of liver. In that condition, we used to monitor what? Portal hypertension. Okay, that is portal venous pressure we used to monitor. Okay, so let's see what are all the options they have given here for this question. 10 mm of mercury, 10 to 15, 15 to 20, and 20 to 25 mm of mercury. So these are all the options they have given here. And among these, the right answer, that is the right portal venous pressure is 5 to 10 mm of mercury. And the rationale I have already mentioned here. Here, the rationale is nothing. That is normal portal venous pressure is 5 to 10 mm of mercury at rest. Okay, guys. So the next one is, yes, to calculate the cardiac output, heart rate is multiplied by. See, they are asking cardiac output and the heart rate is multiplied by. Okay, heart rate is multiplied by. With what? The heart rate has to be multiplied. Okay, to get the cardiac output. This is the question. So they are given 4 options like stroke volume, systematic arterial pressure, pulmonary arterial pressure, circulatory volume. 4 options they are given here. Among these, the right answer, this is very simple and common question. So here the right answer is what? Stroke volumes. In order to identify the cardiac output, heart rate has to be multiplied with the stroke volume. Here you can see very clearly cardiac output is equal to what? Stroke volume into heart rate. So just consider stroke volume is 70 ml and the heart rate is 72 beats per minute. If you multiply these two, you will be getting what? 5 liters per minute. Understand, guys? So this is how we have to solve the questions. Any doubt in these questions, you can drop your message in the comment section. Okay, fine. So thank you very much, guys. As I mentioned already, it is just part 1. Part 2, it is going to release in the next day. That is tomorrow it will be released. So watch the video. If you have any doubts anywhere, you can drop your message in the comment section. So watch the video again and again if you are having any confusion. And please like the video if you like it. If you please like it, share it, and subscribe the channel. Okay. And thank you very much and all the best for your upcoming examination.